Ryan Osborne here with the Denver 7 Digital team, joined by Dr. Neal O'Connor, emergency medicine physician with Health One. And we're going to talk with Neal about, obviously, the coronavirus. 2 positive cases in Colorado came out yesterday, but just sort of this issue in general, what people need to watch out for, what they should be concerned about, what they shouldn't be concerned about, because that's a big part of this too.
Correct.
So I guess just first off, Dr. O'Connor, what is sort of, we had the 2 positive cases here in the state yesterday, but what should people be looking out for? I mean, does that change, having the 2 positive cases here in Colorado, does that sort of change the precautions, or I'm sure it's, people still should just still be careful about, like with any virus, right? Like what should they be looking out for?
So this virus is similar to cold viruses. It's a coronavirus. It's slightly different in that there is definitely a greater illness associated with it, and symptoms can be very mild, cold-like symptoms, upper respiratory infection symptoms, to real difficulty breathing, requiring admission to the hospital. So there's a large, spectrum of disease for this novel virus. Most people will have just mild illness, cold-like symptoms, sneeze, cough, and maybe fever. And I think those are the things to look out for. And I think the main issue is we really want to try to curb the spread of this virus as much as possible.
And what's the best way to do that? What is the best way to prevent yourself, anyone, from being infected? So,
general precautions are avoid being around sick people. Mm-hmm. So if somebody's coughing, stay away from them. If you yourself are sick, you should not go to work. If you have to go out, you should wear a mask. But the CDC is recommending that people do self-quarantine if they have symptoms of coronavirus or COVID-19. Mm-hmm. So I do think that avoiding sick people, washing your hands frequently, and just general precautions like that are very important.
We've seen in this case, and with the flu and other viruses, older patients may have underlying health conditions. Correct. That seems to be a particular point of emphasis as far as precaution. What can that population do to prevent and also notice those signs early so they could get the help they need?
Well, so on the good news side is this virus does not seem to affect children as much as influenza, so that's a benefit. It does affect older people and those especially with comorbidity. So this has been obviously an issue in Seattle with the outbreak at the nursing home. So nursing homes are obviously going to need to take extra precautions with hygiene, quarantining sick patients, et cetera, et cetera. Again, in the general population, however old you are, it's really about avoiding sick people, washing your hands, just the general stuff that's recommended by CDC. Nothing, really high tech at all.
Mm-hmm. Having the 2 positive cases here in Colorado, that was probably inevitable. It
Correct.
Seems like eventually, as it continues to spread, you're going to have cases pop up.
Yes.
I think one thing people might be concerned about going forward is when does it get to the point where may have to stay home from work, may have to stay home from school? Where do you think we're at in that as far as taking that precaution and not panicking, but also preparing for situations like that?
Again, going back to curbing the spread, I think we're already there. If you have symptoms, upper respiratory symptoms like this, you should stay home. Unfortunately, right now, we do not have a large number of tests available for coronavirus in the state. That will improve over time, and hopefully within the next week or 2 weeks, we will be able to expand our testing so that people can get definitive results. Right now, there is a restriction on the number of tests available, about 160 per day, according to the state health department. So now, tomorrow, for example, when I'm working in the emergency department, if I have a suspected case, I will have to work with the health department to decide if somebody's appropriate for testing for coronavirus.
And what is it like being in an emergency room now? Because you probably have more and more people coming in. It's flu season, so they're going to have these similar symptoms.
Correct.
What's the protocol? What's for diagnosing and taking action?
It's a great question. As far as understand, there's no specific treatment for this virus. It's like any other virus, and the only virus that we really have effective treatments for is influenza. So it's what's called supportive care. So if somebody needs oxygen or they need some other respiratory support, we do that. If they're dehydrated, we can hydrate them. If they're truly sick, we may need to admit them to the hospital. But by and large, most people will have mild symptoms. Many may even be asymptomatic. So what it's like in the ER is, right now I would say everybody's being cautious, but we're not panicking. We're just taking the same precautions that we would normally do in any sort of viral outbreak. So you will likely see, if you do go to the emergency department, I think we need to talk about what would bring you to the ER, what symptoms you're having. If you're having respiratory symptoms, you will be masked. You will be screened for fever. And if you screen positive for, travel, shortness of breath, things like that, that put you at a higher risk for for having this illness, you'll be sort of, put in either a negative airflow room or a private room to help spread that, help reduce the spread of the virus within the ED. And then the providers are taking precautions with personal protection, using gloves and masks, and eye protection depending on the severity of the illness for the patient.
This virus, again, the symptoms are so similar to either a bad cold or the flu. What is it about this strain of the coronavirus that does sort of take it to that next level, at least for the 15 to maybe 20% of people that have those more severe conditions?
Yeah, I suspect there's a lot more that is unknown about the virus than is known. We know the sequence of it. I don't know that we truly know the immunology of it, but people with underlying illness appear to be the ones that are most susceptible. People with heart and lung issues. What is the transformation from a mild symptom to severe? I think that has yet to be elucidated. So there's much more to learn about the virus.
Someone in the comments just, they asked about, what about kids at school spreading the virus? I mean, that's going to be, that's probably the toughest spot to prevent.
Absolutely. And again, fortunately, it seems as if this virus it affects kids much less than adults. So that's one very positive aspect of the infection. It really will be up to the health department and the school systems to decide. But certainly, if a child is having illness, upper respiratory symptoms, we should be kept at home.
And of course, spring break is coming up. A lot of spring vacations planned. It's hard to tell, how you can contract this virus as far as where you're traveling, and definitely those specific areas where the outbreaks have been. It's advised to not travel there.
Right.
But what should people be concerned, or what should they consider as they head into this travel season?
That's a really interesting question. We had this discussion at my house today as we're planning on our daughter flying in from Florida next week for spring break.
Yeah.
And obviously it's a personal decision. I think what I've heard is that people are wiping down their seats, so they're bringing disinfectant wipes, so they're wiping down their seats. I think obviously once you're on a plane, you're in close proximity to many people, so there is a potential increased risk for spread. I think the whole concept of wearing a mask if you're asymptomatic is generally felt to be unhelpful, but I suspect you'll see more people on planes wearing masks and things like that. Yeah. Obviously when you're in close contact in a plane, if somebody's coughing close to you, that's a risk factor for transmission.
Yeah. Governor Polis yesterday made an interesting point when he's discussing the patient who tested positive, that when he flew into DIA, he was not showing symptoms,
right.
So therefore he supposedly had a lower risk
Yep.
for spreading it. Is that what you've seen, or is that what you understand?
That's my understanding based on CDC guidance, and that's very important because that really does affect the spread of a virus. Is how early in the disease process are you symptomatic, and are you spreading the virus when you're asymptomatic? And what's fortunate about this virus is it seems as if you are people who are most symptomatic are most contagious when they are most symptomatic. So there doesn't appear to be a long period where the people are asymptomatic yet contagious. Yeah. So that will hopefully help limit the spread of this.
The mortality rate, or at least the mortalities from coronavirus in China, is what is pretty alarming to see some of those numbers. How important, though, is it to keep in perspective the different healthcare systems, between from one country to another, and how that can affect either the severity of the virus, the symptoms, and also how it spreads? I mean, I'm sure it's different from
Right.
every hospital you go to from country to country.
Well, first, I think we have to understand that because testing is limited, we really don't know the scope of this virus. It may well be that the mortality rate is a tenth of what we report in China, because not everybody got tested. People have mild symptoms or asymptomatic. So we truly don't know the mortality. We only know the mortality of the people who were diagnosed with it, and we were certainly not broadly testing. And that's certainly the case right now in the United States. We just don't have enough tests available to test broadly. So we won't know that for a while. To your point, we have a very well-developed healthcare system in the United States, so that obviously will help mitigate the mortality rates based on the availability of advanced healthcare if needed.
Yeah, and we've seen a lot of events and conferences, travel policies that extend into mid-April. Will warmer weather, could that actually help, or do we just not know enough about this strain yet?
Right, we don't know the life cycle of the virus. I mean, basically, with influenza, we have many, many decades of history of, when it goes back to its animal reservoir and when it affects humans. With this virus, we don't know how long the infections will be going on, and how long it will remain in the animal reservoir, and how likely it is to come back or not. So again, much is unknown about this novel coronavirus.
Yeah. Someone else asked how long this virus lasts on surfaces, or I guess would be contagious on surfaces. Summit County yesterday, when they had, they released information today about the condo where the patient was staying, and said, I believe they said health officials said the virus wouldn't be contagious on surfaces after a point of about 2 hours. Is that?
That's the number that we've heard, and I think that's probably pretty reasonable. Again, I think, from the healthcare setting, if we have somebody with suspected coronavirus and they're in a room, that we're going to do the waiting, but then we're going to do a deep clean of that room as well. So I think there's two stages to that. Yes, you want to wait. 2 hours is probably a reasonable, if somebody sneezed on your coffee table, wait for a couple of hours, but then use some disinfecting wipes after that.
Yeah. Anything else about this coronavirus that you've seen that really stands out to you, working with it, maybe seeing people coming in with symptoms that it doesn't turn out to be, but what stands out to you about this?
So far I've not diagnosed anybody with coronavirus, so I can't say that I have experience with it. I think what stands out to me, though, is there's a palpable anxiety about this infection, and I think that panic doesn't make any situation better; it only makes it worse. So I think we need to be cautious. We need to be thoughtful about our actions if we have presumed illness, and do what we can, as good citizens to try to curb the spread. So that means if you're sick, stay at home. If you're going to go to your doctor, call them in ahead of time to let them know. Make sure that they have what you think you need, right? Don't go to a doctor's office thinking you're going to be tested for the coronavirus. They may not be able to do so. Same at urgent care. Give them a heads up that you're coming in, and they can guide you. And again, for the emergency department, coming in for mild symptoms is unlikely to be of benefit to patients. All right, there's no specific treatment. We're not testing everybody, so don't come to the ED with mild symptoms expecting to be tested, because we have to test in conjunction with guidance from the state health department. So it's not guaranteed that you'll be tested if you come into the emergency department.
Because if you just get everyone coming in with, majority of it common cold, maybe flu, it just sort of...
We would deplete our resources within a couple of hours.
Yeah. Well, Dr. Neal O'Connor, thanks for stopping by, answering some questions about the coronavirus. We'll have more updates on this, throughout the day on Denver7.com and the denverchannel.com and on Denver 7 News. But thanks again for stopping by, and we'll keep monitoring this as we go forward. So
thank you.
appreciate it.
Yes,
Yep.
my pleasure.